So welcome, good morning, good afternoon, good evening, everyone. Welcome to the Advocates Corner of HIV R4P, and also today about the COVID-19 conference that's happening today as well. So we are really excited to have a session with the COVID Advocates CAAB here today, talking a little bit about the infrastructure and how this has all sort of happened, gotten started, and how this structure, this CAAB, has really organized themselves. And in a minute, I'm going to hand it over to Matthew Rose, who is just a champion of HIV prevention, advocacy, treatment, and also COVID-19 now as well. So he wears many hats. But before I kick that into gear, we are going to start with an icebreaker and perhaps just a couple of questions just to kind of get the temperature of the room and see where people are. So I'm gonna just start with this question, and this is less for discussion and more just for us to know, where the room is. Again, this is anonymous, so you should feel free to answer freely. We don't know, we will display the answers, but we don't know who says what. It really is a safe and brave space here, and we are, looking for some conversation and discussion today. Great, maybe a couple more seconds. Okay, 3 more, 2, 1. Okay. So this is really, I think, for our panelists and moderator Matthew, for you guys to just see, I think, where we are in this space right now. You have sort of a mixed view of what people know. So here's another quick agree, disagree. The COVID-19 community engagement has benefited from building on the HIV research infrastructure. Okay.
The vaccine trials, they end at the same time.
And we do realize that this is going up against the vaccine plenary that's happening with the COVID-19. Unfortunately, there's a bit of a scheduling error, so we do understand if you bring something that you hear from that space into this space. I think that's important as well. So here we can see that there overwhelmingly people have agreed. We definitely want to get into a quick discussion about that in a moment. But before we do, we'll just sort of take our last poll, which is the COVID-19 responses adequately engaged communities in the research process. Okay. Great. This one was a no-brainer for everybody. Really quick responses. Okay, so we can go ahead and share the results. So I think maybe we'll just do a quick, icebreaker, open this up for a quick discussion again before kind of handing it over to Matthew to think through with the members of the CAAB about this space. As a reminder, we are recording this session so that we can share it in the Advocates Corner later. So we do want you to bring your questions into the conversation, but unless you're asking a direct question, we do ask that you put yourself on mute while you're, waiting to join us. So for that, maybe I'll just ask a quick question to the group on why do folks feel that the HIV, the COVID-19 response has benefited from building on HIV infrastructure, but also hasn't done enough to engage?
I think that's a great question. I'm excited to hear what folks have to say. I was starkly surprised by the responses.
Mm-hmm.
But wait.
Yeah. Does anybody want to bring that into the space?
Me, for example.
Oh, okay.
One of the layas. I think for me, of course, the community engagement in COVID vaccine has built from HIV and tuberculosis. And I only have to look at this room, and we are long-term advocates and activists in HIV. And I know most of you from, way before the pandemic, but there's been no community engagement, or not enough, because we've done our job. But what we see is that the research teams outside the HIV field, or including the HIV field, see community engagement as something to add to the protocol, or something that comes later on, instead of something that has to build from the beginning. So in the rush of the crisis, everybody started to prepare protocols and do research with what they found. It was the key priorities in the plate, or the key ingredients, and they forgot about community engagement. And when they did remember, it was just for a call, or just to try to get a check, like, oh, but I did talk with the community. But we were not involved since the beginning. And I think it's because they did not find our feedback as structural needed as others. That's all.
I agree. This is Marco. I think that a very personal point of view is that we still have not waken up, even though we've seen this horrific panorama in front of in our families, in our backyards, in our neighborhoods, and we still are continuing doing just the same thing as we used to. And so I think that there needs to be, every single person in this call and everywhere need to do an analysis and a realignment of our essence and our values, especially as scientists, and also as advocates, so we can actually forget what hasn't worked and we start innovating. Community engagement has brought innovation into science, has always done that. And so I feel that, sometimes that we have to fight for people to really include community engagement. And what it means is that you need to break bread with people. You need to sit down and eat food and understand our language, our cultures. And so I think that there is a long way to go. It's a long way to go, but I'm going to say that I'm saying this with my heart full of love and empathy, and inviting the community that is in charge or have power to actually make a change of heart and a change of mind, because lovingly we're going to accept the invitations, and we also not lovingly we're going to get in, because that's what HIV advocates have done originally and since the beginning. We have changed the landscape of public health, and we're going to continue doing that, because it's about our dignity, it's our lives and our families, and so they better get ready. And I would just say again, with much love, we're gonna do that with love.
So this is already a really great conversation. So I'm sure it's going to continue, but I want to hand it over to Matthew Rose, who's going to be moderating this session, is a member of the COVID Advocates Advisory Board, working on COVID-19, and like I said, is a long-standing HIV prevention advocate, not just for research but also for access. And I've had the very wonderful privilege to know Matthew for several years now, and just really continued to learn so much from him. And so I'm so excited to have him moderate this conversation today. And perhaps I'll just leave, before handing over the moderation to Matthew, Peter Sands this morning at the COVID-19 conference during the policy session opened up by saying, we haven't engaged the community well so far and need to do better to engage and involve communities moving forward. And I think that that maybe touches a little bit of the two threads in the agree disagree, and maybe we could at some point, Matthew, to get to that question later on in the day too. So Matthew, I'm going to hand it over to you and really look forward to the conversation.
Thanks so much, Jessica. Always excited to be in an advocate's corner. Always excited to have a populated advocate's corner and to be in dialogue and community with colleagues, friends who I've been doing this work with for a long, long time. I'm going to go super basic to the panel first. So Danielle, Marco, get ready. We're going to just go with Elia. Everyone ready? Here's your first question that I want you to engage with, and I think this will be really telling. In the context of community and research, what has disappointed you about where we've gone, and what's giving you hope about where we have been, what has come out, and where we could go?
Marco, did you want to start first? Or I could just jump in if that's okay. I'm going to be super considerate as we dive through this conversation, but I think just Matt, to answer your well put question, what's been disappointing? I think some folks have alluded to it early on in this discussion, and the robustness and some of the feedback is that we struggle as science advocates with basic inclusion in some of the conversations that are going on at the federal and the global level, and even at the state level, right? I'm here in Los Angeles, where our COVID pandemic response is not it's not structured as well as I would have thought for a progressive state, for a state that purports itself to center the human rights of its residents. So I'm disappointed greatly in some of the lack of scientific basis in some of the responses that I've seen from our elected leaders and officials. And we're just coming off of one of the most embarrassing times in our lives as a nation. And so one of the things that's given me hope, sort of to not speak from a deficits perspective, is really how community has continued to mobilize around humanizing this COVID pandemic, right? So I'm always touched when I'm in these spaces with other advocates who are really committed, right, to bringing together a global coordinated response to the amelioration of the effects of COVID on some of the most marginalized populations. So that part gives me hope, right? So the centralization of our response as global advocates is always great. Just knowing that what touches me here in California touches my colleagues in South Africa, right? We were on a WhatsApp chat like through AVAC the other day, and we were actually dialoguing with other advocates in South Africa to ask very poignant questions, like how do we know this variant of COVID originated in South Africa? How do we know it didn't originate somewhere else? And so that really helps us unpack some of the science. And so I'm committed and I'm excited to watch some of this science that we've not seen before, the transformative science unfold right before our very eyes.
Thanks, Danielle.
This is Marco, and I just want to say, for context, that I am someone who has been working on HIV since 1994. I've been living with HIV since 1999, and I recently came to Mexico. My work has been mostly in the US. I came to Mexico, to this island in the middle of nowhere, scared and trying to find some healing after 4 years of hell. And so I have been seeing also the other side of the coin on the pandemic. And for me, the most disappointing the aspect of the struggle is that we continue perpetrating imperialistic, capitalistic, and white supremacist aspects of how we do the work. And we also in my opinion, we have been inundated with information, and there is a lack of language justice, for example. And I, for the past 4 years, I try not to really put anybody on the spot, and rather to have private conversations about people's shortcomings or initiative shortcomings. But it's really hard, you know, how do I explain to my cousins that they lost their dad and their mom within a week? How do I explain to them that the parents were not as important as other people in the world? So the lack of equity, health equity, and the lack of understanding how actually a pandemic decimate communities is really astonishing for me. When this first started, I was living in Reno, Nevada, in the US, and I knew very well what was going to happen with our communities that are marginalized. I knew from the beginning what was going to happen, and I was not surprised when the death rate went to the roof in communities of color in the US. And so it's not okay that I wasn't surprised about this. It's not okay that we continue accepting the everyday life as business as usual. And what gives me hope for me, it's kind of emotional. It's actually the underground heroes that I see and I heard from every single day, where the survivors of COVID-19 that have been actually not given any spaces, any safe spaces around the world, are the ones that are taking care of our communities. Besides the people that are in the front lines in the hospitals and all of those who have passed away, we need to honor their memory, and we need to like really try to demolish and take care of not only the biomedical aspect of this pandemic, but also the structural barriers that actually prevent for people to be healthy and to be actually not to be scared. The misinformation and the stigma that is created. I don't think that the scientist community or the science community is responsible. I think that is responsibility of all of us. And I also think that it's not too late, that there is a lot work to do. So all of those people that actually take care of their neighbors after they experience COVID-19, for me, those are the heroes that nobody talks about, and that we need to uplift their dignity and their humanity, because they are the ones that are making the changes in everyday lives, in the neighborhoods where people don't have healthcare. I think that that's an important aspect of this pandemic that people need to start writing about, because stories are what changes the world, people's stories.
Thanks so much, Marco. I want to kind of draw one of the lessons that AVAC taught me early in my days of coming up as an advocate. It's this discussion that like, it is important that we are engaged in research and make sure the research is best as possible, but 100% efficacious product doesn't matter if people don't use it. So how do we as community advocates kind of bridge that gap of explain to people what is the current science, what does it mean in the context of people's lives, and how do they get comfortable, and we answer their questions about kind of, at this point, getting a shot in the arm, but other technologies might come on board. Where is that dialogue happening now? And what do we need to do to amplify it and make it better? And we know some of that is, from my perspective, is us being in the trial work from the beginning all the way through, so that they go, oh, I know that girl. She was there from the beginning and she can tell me what happened. But what chances do you all see can happen? What are things we as advocates need to be pushing for to get translational work done? Marco touched on a little with language justice, like being able just to talk in someone's native language about what the hell is going on with science. But the two of you, kind of, what do we mean when we have to get from science breakthrough, as we've seen with vaccine, to actual vaccination, making science actually happen? Because it's always a two-part system.
Marco, were you going to come off mute?
Danielle, you can go ahead. We have like a rhythm now, so I'm just gonna go with that.
Okay, I'll go with the rhythm. So I think, again, great question. Matt. So I'm always challenged, right? I consider myself to be a translational community activist. It's really, in that sweet spot where we bridge the science and take it to communities. But part of that hesitancy, part of that resistance is how we engage with communities that are most affected by this pandemic. And some of that comes with us in our understanding, our fundamental social justice, racial justice centered approach that we try to lend to our work in HIV. So it's been translational in COVID. Like we have that heart, we have that essence to take with us. But what's worked for me in the communities that I work with is being a trusted source of information, really just showing up with that objectivity to give the kids the information like, hey, here's the tea. This is what we got. This is what we know we don't have. And I'll put that into context. Today, there was an article that said 5.4% of individuals vaccinated with the COVID vaccine are African American. But when you juxtapose that to some of the horror stories we hear about folks attempting to be vaccinated but are turned away because they're not within the priority vaccination groups or because they merely don't have access to adequate health care. And when you put
Oh, we've lost, no, Danielle?
I'm back. Sorry.
Okay.
When you put that into further context about how minority communities are often medically disenfranchised, don't have access to adequate treatment for issues outside of COVID, when you throw into that some of the social structural issues, you really have to start from the bottom. You really have to start at the basics with humanizing people's situation first, and then getting to a place where we build trust. There's always, that specter of the Tuskegee experiment that sits within the lives, the very real lived lives of folks who don't always engage with the research infrastructure. And those stories, those experiences demand respect, and they demand to be contended with as we roll out some of these plans and strategies to engage those individuals who will most likely, most certainly, sit at the nexus of social ills and poor health outcomes, and how we really look to meaningfully engage them into some of this other work. So when you talk about translational research, when you talk about really meeting communities where they are, this is the way you have to start by building trust.
Danielle, real quick before I pass it to Marco, for folks who are not familiar with Tuskegee, can you give a quick synopsis?
Absolutely. So the Tuskegee Experiments, or the Public Health Service research project, was one of the most harmful and inhumane, I'm going to say, experimentations to befall Black or African American males in this country. Those individuals were allowed to move forward in a publicly funded study with syphilis and not offered a treatment. And so it's the framework for it's the framework and backdrop for a lot of medical mistrust that communities of color, specifically those individuals who identify as Black or African American in the US, it really affects how we engage with systems of care and research infrastructures as well.
Marco, you're up.
I also think that the fact that health is connected to the police, to the immigration system in the US, I'm talking about the US, really hinders our work in science with communities. The fact that the police is taking care of folks with mental health on the streets, it really hinders our communities. And so public health or health science, we need to stay away from attaching ourselves to systems that actually have been proven over and over that they do more harm than help. In the case of HIV criminalization, for example, and many other things where our consent, I think that consent is an issue that for me is really important, and that we experience struggles in the HIV field all the time. the distrust of the Tuskegee experiment that is, is shameful. And people are like, well, how come you don't just snap out of it? It doesn't work in that way. It does not work in that way.
It most certainly does not.
I think that it's important that we also just threw off the window this idea of the survival of the fittest. That is a bunch of crap. Who is the fittest? The fittest are the people that have the power and the money, and most of them are white folks. So we need to, in order for us to actually do justice to people in the world, we need to change that, because when the playing field is not really even, how is it that we're going to have a just system of anything around health? So I think that we need to just go back to the drawing board. And I understand some of the comments in the chat box about new generations. I also think that we don't have time to just wait for another generation, because we all can do that change right now. It's not very, in my experience, doing advocacy, doing oppositional advocacy. It's not glamorous. It doesn't feel good to be constantly fighting with folks. But when you look the other way and you see your community like dying left and right, I mean, what else is for us to do? And I think that the scientist community, once again, I'm going to appeal for your heart, because I think that from all the people that can actually really understand the systems of oppression and how they work in the world, it's all of you. You have, and I know that I'm preaching to the choir. I'm just gonna say that. And I acknowledge your work, but I think that everybody can interrupt oppression, and I know that it sounds very abstract, but in reality, here I've been in Mexico since December 3rd. Like, I don't know when I will be vaccinated. I have no idea. The government hasn't said anything about, and I'm coming back to the US in May. I've been trying to take care of myself and the people that I know, and every single person that I talk to, I talk about COVID-19 and how they can actually protect themselves. That's the least thing that I can do. But I do feel that we need to just, in my opinion, there needs to be a communion of the community advocates and the community and the science world. And again, TB and HIV has taught us so much, and we're just not really using that knowledge. We're not.
I'd agree, but I also would counter with that HIV was fraught with its own issues before COVID came along. And with us, those traumas come with us into the COVID-19 research space, right? I think we were a prime population of advocates to target, just given our, fundamental expertise with advocating, with understanding, again, some of those social justice related concepts and frameworks that were necessary to push scientists, to push the envelope in terms of what we see coming out in terms of trial results, to actually do better. And I'd agree that systems of oppression commingle very actively, I might add, with what we see playing out in terms of the vaccination.
It's true.
Or lack thereof of communities who would most certainly stand to benefit from being vaccinated.
So we're about to open this up to questions. This is my last question for the group. But when we get to the questions, please hit the raise your hand. So it's on reactions at the bottom of your screen. Hit that and we can scroll through and call on you. That will just make it easy and orderly, or you can drop questions in the chat. I'll also be watching that. But my last question for the panel before we go to everybody else's, both of you have spent time confronting researchers, engaging with researchers, talking to researchers. What are strategies that you think we should be employing more right now to get in front of folks and change the research narrative? Now, I'll start by saying that I personally, in the past, I could just show up at a conference, run to the microphone for the first question, and read someone for filth from the carpet, and that would get my question out. But now I find in the Zoom environment, the same thing can happen, but I have to bring a squad of friends so that we can all be ready to raise our hands on Zoom. You're like, well, you can't ignore all of them. where are you two seeing sites of opportunity to change the conversation and to hold research accountable to community? Because, especially in those early days, like I still remember in September when Pfizer was like, we got to slow down this vaccine trial. There are no Black and brown people in this thing. This is
Baby.
bad.
Mhm.
And now we're seeing the same thing with rollout. We're seeing, ACTG has worked on some of their Act 2 trials, being like, ooh, this is harder because we realized we needed people of color and weren't getting them. We're finally rolling out international trials, but realizing that has its own struggle and making sure that the most marginalized in those countries are involved. So where do you think we should be hitting the research community hardest, and what are effective strategies in the time we're living in?
I think, Danielle, I'll go. We'll get off our rhythm for the sake of dancing a little bit. I think that I feel that it's really important for people to understand what is happening in the community, and not just to have this abstract idea. And that's why I was saying that storytelling is so important. Perhaps, scientists can engage in storytelling. I think that it's important that also the engagement is truly it's truthful. I see it in two big community boards that are attached to researchers, and the work that I've done with CAAB has been so meaningful and grateful that I have engaged with my colleagues that are amazing scientists. In the other group, I have been asked just to give suggestions about a video or something like that. So the true engagement with community has not happened, because I also think that we have to just completely change how we do that. And there is a lot of unlearning that needs to happen in the scientist community to actually engage with folks. I think that language justice, Matthew, I'm gonna just go back to that, is a super important aspect. And also, who is the gatekeepers of information, and how is it that we're going to actually read information that is truthful and that is not complicating our existence even more? I feel that there is, I put together a group that we actually engage in conversations in Spanish, where we can translate to people a little bit what is happening, because they were scared. This idea that I think that the world is upside down, and that instead of us, the folks that have knowledge and power, help the most marginalized or the most vulnerable, we go and do the opposite. And for me, it's like, I'm not going to go along with this narrative anymore. I'm not going to just continue just repeating this narrative that when people call me an extremist because I actually want justice, I'm like, no, you are the extremist. I'm just somebody who wants to do the work. So I think that is important for us to stand up. I think that we are learning as we go. But for me, the commitment to work with my community is ignited every day, that I continue seeing the numbers not changing. Danielle.
Thank you, Marco. So Matt, to respond to your question, I think for me, what I know about advocacy, right? So I'm a daughter or a granddaughter to I would say one of the most coldest advocates for racial justice in the South. So it's something that's in my blood, to fight against systems of power and oppression. So what's always worked for us is mobilization. It's gathering like minds, sitting around a table, sitting on a call, sitting on a Zoom session to talk shop, understanding what the issues are first, strategizing on the best way forward second, developing a plan or a strategy to mobilize others of like mind, and then showing up in spaces to where we're not invited to, two, where we know that those individuals who control the scientific agenda are, and just showing out. right? Taking them back to a place where they understand that these are people and not just numbers that are consistently losing their lives to this battle with COVID and, more proximally, what we know to be HIV and other social ills that plague this planet. So to the point of what's been discussed before, we got to do better. And we have to continue to hold those individuals accountable who control the systems of power and oppression that we fight against every day to just survive.
Excellent. Well, we will now open it up to questions for the panel. I will say, for those of you on the call who know me, some of you can be voluntold if you don't have questions. So it's in everyone's interest to ask what you need now. At least maybe someone else's name gets pulled up for a discussion.
Jessica posted a chat in the question. A question in the chat.
Researchers engaged in COVID have HIV backgrounds. Do you think that the influence lack of engagement with the TB world, there seems to be a lot to learn from stigma and research literacy. And it's a great question. I mean, the TB world, as a person who has a toe in that world, mainly because the leading killer of people living with HIV is TB.
Indeed.
There's a lot to think about and a lot to learn from, I don't know, another respiratory virus that has plagued the world and until recently was the leading infectious disease killer. Oh, weird. What can we learn from that? Marco, Danielle, thoughts?
And why is it that only 230 people living with HIV have been involved in trials for COVID-19? Why is it that we had to fight tooth and nails for us to be included, meaning us, the HIV community, included into the trials, and later to the resistance and the lack of acknowledgement of such agreement, have to fight our way in? I think that those are signs of just like completely unrest. I do want to say that I have not worked directly with TB, but I honor the work of advocates around tuberculosis. And I also honor the history, and I've learned a ton from that. And I hold that in my work when I do my work. Danielle.
Can you guys hear me?
Mm-hmm.
Mm-hmm.
Okay, great. So to respond, I think Yvette has a question as I respond. So I think it's like, for me, it's always a no-brainer, damn it. Like, as a public health person whose work is centered in social justice and health equity, like, why would you not? Like, Matt, you hit it on the head. Another respiratory illness that plagues the world. And then we have one coming up the back. Like, why would we not first look to our TB advocates to center us at the table, not only with understanding some of those mechanisms of action scientifically, but some of the challenges that are fraught with advocacy within that disease state? It just makes total sense to me that we would, again, center those who are most minoritized, who are most affected in some of these health outcomes. We would center them in these discussions and learn lessons, give this as an opportunity to elevate and amplify those efforts into a strategy that we could actually use to change the outcome of the health of the world. Like, if there's not one thing that COVID-19 has taught us, is that we do not, in countries, borders don't isolate COVID. We are connected as a world, and we have to engage different strategies if we're going to see our way through this pandemic. We just have to. So it's a no-brainer, seriously.
Matthew, and very quickly, I just want to say that I am part of, I actually co-chair this group that is called HIV Racial Justice Now in the US, and it's about 20 advocates of color that came together, created and wrote a framework called a Declaration of Liberation, where we are telling the HIV community that the only way that we can actually end HIV is through a racial justice lens. In my opinion, the bridge, and these are the words of my beloved colleague, Benita Ray, the bridge between COVID and HIV is really racial justice. And so that's a lens that people need to put on and understand what it means, racial justice. What does that mean? It's an important question that needs to be answered by each of us. And once again, I think that we just need to make a pause. Very, very lonely, alone in your house by yourself, and really like go through your essence, and anything that is not aligned with justice for the world needs to be put into place.
I'm so happy to have my homegirl Yvette, because I was about to call on her because I know she's got opinions and they're always smart. So Yvette, bring us your question.
Hi, Matthew. Thanks, everyone. Good afternoon from South Africa. I just like our panelists and their vigor today with regards to the COVID pandemic. Are we even part of the discussion? When we do advocacy, I mean, do we even count in this COVID discussion? Like Marco has said, this is very, very capitalistic. And sometimes when it comes to the COVID pandemic, I think we are complicit as advocates by accepting the bare minimum and BS, right? So countries continue to, it's the government's running this. Our friends who are researchers in the HIV pandemic are doing the research, but coming to us and actually telling us what's going on behind the scenes is difficult. So what do we do as advocates globally to ensure, we're not fighting for a seat at the table, but holding our governments accountable? It's just a whole lot of corruption. And I will be honest right here, right now, to say, I am skeptical about the vaccine myself. Not that I don't believe in the science, I don't believe in the vaccine, because I don't know anything about it. I don't know that much, I've not been engaged. But like I said on our call previously, we are the weekend specials. What's going to happen is government is going to call on community advocates to say, go in and go and educate your communities to take the vaccine. And like the fools we are going to be part of that discussion and going to go to communities, take the vaccine, where we ourselves don't have all the answers. And I think that is an injustice to our work and an injustice to our great names as advocates to say, we don't even have seats at the table. I don't know of any advocate. I really, really don't know of any advocate who's sitting in a COVID task team where government is sitting. They are distributing vaccines. Some are lost. We are getting surprise COVID vaccines from anywhere and everywhere. And we are expected to tell our communities, this is what you must do. And I'll be honest, I don't think we are doing justice to communities. I've always wanted to write a book about how we as advocates sell our communities to the highest bidder. And I think this will be about the time I do that, because really, really, we cannot sit here and say we are okay. We know what's going on, and we will translate the difficult science into community language for our communities to take this vaccine. Thank you.
I love that. I love that, Yvette. I also want to say that, why is this conversation not in the main conference that we're attached to right now?
Yes.
Why are we not there next to all these incredible people that we have seen day after day after day in the media, when people are asking us, how do we engage with community? So to the International AIDS Society, I would say, by placing these conversations front and center. That's how we do it. And I love you, Yvette. I love you forever.
I love you too. I love you too, Marco. You're my kind of activist.
So, love fest aside, I'd like to echo what's been said here, right? We have to mobilize and educate and offer choice, right? At the end of the day, people should be free to decide what they want. So,
Yes.
Yeah.
Lovemore, you're up next.
Hello. Can you hear me?
Yes, we can.
Yes, we can hear you.
Okay. I was wondering, like, when you have put these outbreaks, when you look at things like Ebola and COVID, they put so many resources at the same time to make sure that they find a solution. But when you look about HIV and AIDS, we had years and years before they introduced the ARVs. I don't know what's going on. Is it because we are not advocating enough, or they look at what is the emergence to them? Because they should have to. We talk about HIV, then we are saying we want it to end in 2030. But when you talk about COVID, we are saying in 1 year, 2 years, we should have found a solution. They are not putting too many resources on HIV and AIDS? Because by now we should have found something that is concrete. Because they are talking about the vaccines and so forth. How can you find a vaccine within 1 year? We have not participated in it, but already have got a solution for it. You talk about HIV and AIDS that has been there since 80s, but we don't have a concrete solution for it. We are still saying, let's keep on advocating, let's keep on pushing forward. All these vaccines are coming from everywhere in the world. If they have done that to HIV and AIDS, I'm sure we would have been having vaccines all over the world, and it could be something that we are talking about, something that would have been gone by now. Is there something that can be done towards that? Thank you.
Danielle, Marco, thoughts?
I keep hearing somebody doing amazing meditation, but would you mind put your phone on mute?
Jessica, you got it? Cool. Danielle?
I'm sorry, I didn't hear the question.
Just kind of thinking about these delays that we've seen from public health responses, one of the things, I can answer it for a little bit. Like, one of the things that has always bothered me, and I tell one of the reasons I work in HIV and work for actual justice in HIV, because the last thing I want to have happen is for us to end the HIV pandemic and then just have the next disease roll on in. Every time we fight some big outbreak and epidemic, we should be bridging more justice, more equity, and building more infrastructure that actually improves the health of community so that we are either more resilient or just able to handle things better. If we end the COVID-19 crisis and all we end up is everybody getting a vaccine and an infrastructure that disappears as soon as that vaccine is given, we will have failed as a world in our understanding of global health. But if we make it so that people whose bad health conditions have been there a long time, who we've seen have been there a long time, don't have to be at the bottom, or the bottom just doesn't have to suck as much, then we're making actual progress.
I'd agree with you. I think a lot of what we see in the vaccine response and the COVID-19 response in general globally has been very reactionary. It's just been, it really highlights for me the lack of preparedness we as a global nation have around emergency response to some of these pandemics. It's because we haven't contended with a lot of the shit that plagues the citizens of our countries. Right, so we hear all the time about equitable access to COVID-19 vaccinations. We'll add on to that from a US-based perspective, equitable access to healthcare, equitable access to the right to just exist, equitable access to have sexual and reproductive health rights and justice, right? So it's a lot. I think to your point, Lovemore, what we see in the lack of, and I don't want to keep saying lack of as if, we want to just highlight some of the negativities. I think, on the positive aspects to it, the scientists come a long way in HIV. And as we know at this table, it's because we've had that, quote, disruptive innovation and push the envelope as community activists who show up and show out in some of these spaces and continue to hold these systems of oppression accountable to the best of our abilities. However, I think there's much more work to be done. I think, yes, we're exhausted, but I think at our core, we have the commitment to want to see a better nation where we can live and thrive as individuals.
The conversation, very quickly, Matthew, the conversation that we haven't had and we had touched a little bit is that we haven't really engaged on talking about those who may not be okay with getting a vaccine. And furthermore, why are they not okay with taking a vaccine? Putting aside all of the theories that happen in the US, I don't know, in the rest of the world, conspiracy and all of that, putting all of that aside, there are members of our communities that are scared for some of the reasons that Danielle touched on. And also because there have been a lack of dialogue about what really is happening, because we have not placed the community front and center, the voices of the community. And so I think that we need to have that conversation, and we need to stay away from shaming and creating more prejudice against those folks that are not okay, that have questions about the vaccine itself. I think that that's really, really important to do, and to take down those barriers, those prejudices. We need to engage mobilization and conversations that are actually about everyday people's lives, and not so much maybe attach them to whatever scientists have found, because finally, what is going to move people is people itself, or is us.
Mm-hmm. I'd agree with you there.
Yvette, is that another question for you? Still up.
No, I saw a question from Marinike.
Marinike, you can unmute yourself and ask a question. We know you ain't shy.
I'm not shy, but I'm not sure it's a question. I think I raised about your statement about ending the epidemic, and I think it's something I've discussed severally. That whose definition is ending the epidemic, when the official definition of ending the epidemic is leaving 5% behind.
Yep.
When you say you are ending at 95, you are telling us that 5% is left behind. The 5% population in Nigeria is equal to Botswana as a country. I'm not sure you appreciate that. So I think UNAIDS and Geneva and all those places can keep reiterating their 95%. I find it very sensitive and unkind for we as community advocates to continue to reiterate that ending the pandemic is a 95% target. We are going to be left with a 5% to care for at the end of the day, and we had better start preparing for that. That's just a side comment. It was a reaction to your comment, Matthew. Sorry about that. Yeah.
No, very important to the conversation. One of the reasons I love working at HealthCap is because I get to say things like, I think you don't end it until you end it for everybody. And ending it for everybody doesn't mean that there's a token amount of people that are just like, hey, enjoy this bad thing that we knew was bad, but you're hard to reach. So we're gonna just kind of leave you out there to suffer, even though we've all agreed that this is a bad thing. Like that makes no sense to me. I always said I'm in this fight until there's a cure, because
absolutely,
even in a world where we end the epidemic, you're really just talking about transmission levels and prevalence levels, but there are still a bunch of people living with who would rather have a cure. And that's what was promised, and let's reach there. So definitely point well taken.
There's a comment.
And Lila is making a point about people that, COVID-19 survivors. I think that, I'm going to say it again, I think that there is a lack of spaces that feel safe for people that are survivors. And I think that it is our responsibility to create those spaces and to start giving opportunity for those voices to come up to the surface. As people living with HIV and survivors, a lot of you of HIV, we know better what that means, and how silence and how this idea of putting you aside damages our spirit. So I think that aligned along the lines of the book that Yvette is talking about, we also need to write the book of the survivors of COVID-19. And how is it that right now, once again, I'll repeat it, how is it that right now they are the ones that are making a big difference in our communities along the lines with the people that are the first responders and the community, the medical community. Our neighbors, our moms and dads, our brothers and sisters, those are the ones that are helping us to deal with COVID as we are told to go to the hospital when we cannot breathe. So that's a big, for me, that is a big story that needs to be told.
Agreed. Agreed. I definitely think it's important to tell the story of those individuals who are at the center of this thing and their families as well. Like, I think we should come together and tell. It would make for a great discussion globally.
All right, we are about at time, so I will ask final thoughts from Danielle and Marco. What do you wish people knew, did, acted on, etc., or took home with them? Ready, set, go.
I'm clear that the world is not new to the conversation around justice, oppression, mistreatment, marginalization. It's as old as the world itself. And I need people to stand up and stop playing like they don't know what needs to be done. This isn't the first, social ill that we've accepted or come across as a nation. And until we do better to center those groups that are most affected, that are most marginalized, that are treated the most inhumane, today we talk about COVID, tomorrow it can be about something else. We must do better. And that's just on period.
Ditto to Danielle, I also want to say that these times are very difficult to just experience. And what gives me hope and what I wanted to tell you is that John Trudell talked about power, and John Trudell, a Native American extraordinaire, said about power that those in charge of governments, those in charge of the wealth of the world, they think that they have power, but that is not power. That is an imitation of power. What they do, what they have is brutality. And so for those of you who may feel disempowered at some point because you are suffering and you see your community just going downhill, remember that the power, the true power is us, the people that are connected to the earth, the people that are connected to other people, and that those who are in charge making decisions and taking decisions and changing our lives, sometimes causing so many millions of lives to be lost, those are not power. That's an imitation of power, and that is brutality. So I hope that you uplift your humanity and your dignity, and that you continue fighting nonstop until we see that this world actually comes from the upside down place that is right now. Thank you so much for coming, for being with us today, and for whatever you are in the world, just receive all my love.
Stay
Thank you,
safe and
Danielle.
take good care. Thank you, Marco. It has been a pleasure to share space with you and everybody else on this call. We do hope that you enjoyed this conversation, our very power-centered, social justice-centered discussion, but we are ready, we are tired, and we need to see something different from the world. And each one of you all, do better.
Thank you all so much for joining another AVAX Advocates Corner discussion. Please remember to follow communications and stuff of AVAC. They routinely bring us together to have these discussions as we, the hive mind, figure out what we need. As you said, science needs to be informed by those of us and those who look like us, who put their bodies on the line and offer of their bodies to make the science happen. And that promise of what our bodies found need to be delivered to our communities because that is the contract we all enter into. Leah, any final thoughts?
Hasta luego. Muchas gracias. Besos.
Bye, everybody. Have a great evening, day, morning, and keep up the great work you're all doing.